other areas. But course fees have actually declined by 2.4% in the absolute figure of $424,723. Other course fees have even shown greater decline, 80% decline in the income, from 2.18 million in 2011 to 11.9 million, 446% growth in 1 year alone. Well, it's nice to have 11 million in your pocket, nobody would say no, but I'm worried at what price? There's no free lunch. At what price? We have seen from the accounting statements that maybe at the expense of some useful courses that could have been done which could not have been mounted. That's just one possibility. Maybe management spent too much time running after consultancies, drawing up consultancy proposals, rather than designing courses that they could have marketed and research programs that would have paid.
The Management Development Institute, MDI, has been found substantially compliant with 86% Gambia Public Procurement Acts and Regulations. MDI, as a training institution in the country, has been in existence for more than 30 years, offering professional and diploma courses, and of recent, launched postgraduate diploma in business studies. The management has expressed optimism to forge ahead, given the critical role entrusted to them in capacity building for the socio-economic development of the Gambia. Buba SMCC, GRTS.
Nursing officers in the communities of Jara West, Kiang West, and Yanijar on Wednesday received 3 motorbikes and 3 ambulances from the Ministry of Health and Social Welfare. In a separate but related development, on the same day, the Banjul office of the World Health Organization handed over medical equipment to Edward Francis Small Teaching Hospital. Ominjai was at both programs, and this is her report.
And 3 motorbikes to the communities and nursing officers in the Jara West, Kiang West and Nyanija are meant to ease mobility constraints for the beneficiaries. Health has been one of the main priority areas for the government, and the Health Ministry is strengthening efforts to achieving this. This presentation of 3 vehicles and a similar number of motorcycles is a clear manifestation of this drive.
So without more ado, today we realize that in the same vein that we want to address and try to take healthcare service to the doorstep of the citizenry, the Member of Parliament championed this, and as a ministry we studied, honored, and today we are implementing. We created 3 new stations in very difficult areas, hard to reach areas for that matter. Each of them will receive a backup ambulance to coordinate referral services in that area. Each community health nurse, newly created post, will be given a motorbike, brand new motorbike.
It could be recalled that the National Assembly Select Committee on Health recently concluded a countrywide tour in all public health facilities with the sole aim of obtaining first-hand information on the challenges facing some of these facilities. Barely 3 weeks after the Select Committee reported back to the body governing all health facilities in the country, the body has responded quickly to the recommendations of the Select Committee.
The link that I'm seeing beginning, and people must read all ministries, all aspects of our service people, so that if that continues, the government is going to be seen as one unit. Our society is going to be seen as one unit. Interdependence and reciprocity. The National Assembly is very grateful, and I want to say on behalf of the entire National Assembly, we thank you profoundly, because we in the National Assembly do not see ourselves as individuals representing constituencies. This is why the description now is National Assembly, not Parliament, where each of us will advocate for the region you represent. And if you have this for 3 constituencies who serve people who are hard to reach.
Empowering our National Assembly matters by providing ambulances and other needs for their communities, because National Assembly members are also representatives of the people, and what you are doing is community-based. So there is a dialectical relationship between what you do in health and the National Assembly.
In another related development, the World Health Organization, who are also key partners in government's drive to uplifting the health status of Gambians, has handed over medical equipment, including pulse oximeters, patient monitors, oxygen concentrators, amongst others. These vital medical equipment are meant for the intensive care unit of the Edward Francis Small Teaching Hospital.
Today, we are very opportune and lucky once again. We are presenting some brand new medical equipment which are kindly donated by the World Health Organization in the Gambia. What happened was sometime last year, there was a great need. There was a request which emanated from the EFSTH Hospital new management team, who gave us a list of vital equipment and drugs that were required.
As my PS has said, yet again we're here with the good leadership of our Honorable Minister and the support, unflinching support of the World Health Organization. This is showing the cooperation and the partnership that we have with our UN organizations. We're always knocking on their doors. When the hospitals or the institutions knock on our doors, we also knock on the doors of our partners, and you can see that they are very, very responsive.
We are doing this upon a response to a critical need of this important hospital. This is the premier hospital in this country, and for that matter, the equipment and supplies to address emergencies are of vital importance to the health care delivery in this country. And as we've heard from the PS, when the emergency call came, WHO responded. We responded by providing resources to purchase these vital equipment and supply to the hospital.
Today, I think, another happy day, personally to me and to all the staff, because we received very important equipment. I think now we are in the right way, because we ask about what we need. Please, if anybody want to donate anything for the hospital, they must ask what we need. We need this equipment for the ICU. Maybe with this equipment we can save a lot of patient life.
With the donation of these hospital materials, health officials were quick to urge the beneficiaries to utilize the vehicles and motorbikes for their intended purpose. Uminjai, GRTS.
A 4-day synergy for farmers and small-scale entrepreneurs is on the way at Genoa Agricultural Training Center. The program, organized by the National Agricultural Land and Water Management Project NEMA, also attracted operators in the rice and vegetable value chain. Winifred Nicole Hodibet has more.
Representatives drawn from across the country for a 4-day tutorial meant to further enhance their skills along the rice and vegetable value chain production.
This training, yes, there's lots of entrepreneurship training going on in the country. They've been, for years now, they've been having different types of training. But particularly, we have an interesting component, which obviously it adds value to the training, and that's the Capital Investment Stimulation Fund. That is a fund that is available for small-scale holders to be able to get access to credit, to be able to grow their business. We want to see farming grow from the rudimentary farming that we used to do, to a more mechanized farming. So we want to create opportunity where farmers and potential businesses will get access to machines that will actually work for them on their farms and grow their business.
This step-down training, which marks the initial implementation stage of the NEMA project, comes barely a week after the project signed an MOU with Reliance Financial Services.
Given the speed at which the implementation has been initiated, we in the private sector, we pride ourselves with making sure that we attend to deliverables as quickly as possible. And this is a manifestation that we, in partnership with NEMA, would be in a better position to ensure successful delivery of this project.
The expectations under the MOU have been clearly spelled out and value high, and the message